Hi, ladies and gentlemen. Today, I want to enlighten you about a common condition that causes pain and sensory disturbance on the outer part of the thigh. You might know someone or maybe yourself suffer from this condition in which you have pain, numbness, tingling on the outer part of your thigh. So, this is what I'm going to be enlightening you about today. But before I go into that, I'd like to welcome you back to Brain Gist. This is a channel dedicated to enlightening people about the conditions of the nervous system affecting the brain, spinal cord, nerves, muscles. So if you're an enthusiast of the nervous system, I think you would enjoy the content of this channel. So today I'm enlightening you guys about this condition, which we call meralgia paresthetica. So the name sounds complex and difficult to pronounce or to understand, yet it's a very simple entity. So it affects women much more commonly than men, but then I see it in both categories of people. So people who are afflicted by this condition usually present with pain, numbness, tingling, burning, crawling sensation, pins and needles affecting the outer part of their thigh and a bit of the front part as well. So, what causes it? There is a nerve that is supposed to help to feel or control this area of the body. The nerves in the body are quite very specific in the parts or in what parts of the body that they control. So the nerve that is destined for this area, that covers this area, is called a lateral cutaneous nerve of thigh. And this nerve passes through a fairly long course from its origin. Like many other nerves in the body, they do not necessarily arise close to the area they cover. Many of them travel long distances from their origins before they arrive at their destinations. So this nerve, called the lateral cutaneous nerve of thigh, has a very similar fate. So it arises somewhere in the back and then travels in between muscle planes and goes, through tissues and then arrives somewhere around the waist here and dives beneath a tough tissue, very close to the bone, just above the hip, and then before it goes to its final destination in the outer part of the thigh. And because of this kind of complex tortuous course and the fact that it dives beneath kind of tough tissue bands in the front of the um, hip here, it's quite vulnerable at that point to entrapment. So when this nerve is entrapped or pressured upon or compressed at this area, then people start to have the symptoms I just mentioned above or earlier. So why would this condition arise? Why would people start to have entrapment of this nerve? One reason could be because of recent weight gain. So especially in women who've recently gotten pregnant, it arises in pregnancy sometimes because of rapid weight gain and what other condition that causes increase in weight. Those conditions can certainly lead to meralgia paresthetical. Other reasons for which people develop these conditions are people who wear tight underpants or wear tight pants or tight belt around the area. That puts physical pressure on the nerve, and over time it starts to generate they start to generate symptoms. And then sometimes people who are starting to do a lot of exercise, who were not previously accustomed to these kinds of exercise, this can arise in them, and sometimes we can't really find a risk factor. And in the clinic, we are very careful to examine this area. We take a pin and we try to prick through the thigh, and we can delineate it very nicely the area that is covered by this nerve, and it tends to coincide very nicely with the area where the patient is complaining about. So there's a nice precision. They were able to delineate the area in the clinic when we do pinprick examination. And sometimes we also do a dedicated nerve test, what we call a nerve conduction study, to study this nerve and we compare it to the other side, and we're able to demonstrate that indeed this nerve is abnormal and that's the cause of symptoms. So I'm not saying that that's the only cause of pain in the thigh, but there are many other causes, but this is certainly one of the common causes that I see in the clinic. And how do we treat it after we've confirmed that this is meralgia paresthetica? Usually, treatment options vary from medications to relieve the sensory disturbances like pain. And then, of course, weight gain is essential for those in whom we think is caused by weight gain. When you weight loss is important, sorry. And then when the individual loses weight, the symptoms eventually regress. Sometimes we put patches on over the area, and sometimes we resort to interventions that what we call nerve block. So we just inject that nerve to kind of silence the nerve or numb the area or numb the nerve, and then the symptoms regress. So I believe there are also some physical therapy modalities that can help to, treat these symptoms. I do hope you learned something today. If you did, give a thumbs up, share, like, give your comments, and I like to see them. And I do hope you enjoy the video. See you next time. Thanks for watching.